David and I haven't got children, so our nieces and nephews are that little bit special.
Over tea and cake, they talk about him. The nephew they loved, looked out for his whole life.
We'd go for lunch, which was always great fun with Myles because I could tell you exactly what he was having. Scampi and chips.
Their house scattered with memories.
And of course football, he did come alive at football. So.
When you say football, I saw this picture here. Is this of you, that feels like a football match?
That is in Wembley. That is when Huddersfield Town got promoted to the Premier League. And that's the exact moment that the final penalty had gone in. And he grabbed me and he said, "Uncle Paul, I'm so glad I'm here with you." And the thing I would give anything for is just one more Myles hug. It's the Myles hug that I really, really miss. And, I wish I could have one.
Myles Scriven was 31. He was autistic and learning disabled. In late 2022, he became unwell with shortness of breath and a blood clot in his leg. The blood thinning medication given by Calderdale Royal Hospital wasn't working. Months later, Myles was still unwell, but instead of changing it to another drug, doctors insisted that Myles wasn't taking it when he was.
To all intents and purposes, other than his learning disability and autism, Myles was physically well. There's lots of different things that can be done, but unfortunately these opportunities were never afforded to Myles, really because he wasn't believed, and because he was learning disabled and autistic, he wasn't really able to engage in decisions about his treatment.
In March 2023, Myles was deteriorating. His mum, who's also learning disabled, and stepdad called their local GP, who held a phone consultation with Myles, despite his stated issues with communication, and despite his shortness of breath, was not referred to A&E. 3 weeks later, Myles collapsed at home and later died in hospital. At no point were Paul and David, who are his stated medical advocates, contacted by the GP or the hospital.
I was on the phone when the nurse came in to the relatives' room and told them that Myles had died, and it was really, really difficult. And, going through the inquest and hearing that this was preventable, hearing that Myles could have been saved on at least 3 occasions, was really difficult.
In your view, if Myles hadn't have had a learning disability, do you think he'd still be alive?
Oh, absolutely. There's no doubt about that. If we'd have been called at that point, as the law states for somebody with a learning disability, family and carers should be involved, we would have been able to support Myles in making a decision that would have probably saved his life.
During the inquest into his death, the hospital trust tried to claim that Myles did have the mental capacity to make his own medical decisions.
David knew Myles for 28 years of his life. I carried Myles in the first few hours of his life, and I carried him on my shoulder in his coffin to his grave. He didn't have capacity, and they were trying to tell us that people who had been with him for 10 minutes knew him better than us, and it's unforgivable. It was trying to save their reputation rather than reflecting and trying to save the lives of people with learning disabilities.
Official data shows that men with a learning disability die 20 years younger than the general population. Women die 23 years younger. Professor Sarah Ryan has dedicated her life researching why. Her 18-year-old autistic son Connor died through neglect in 2013 at an NHS facility.
I think I was struck by how similar Myles's death was to Connor's, in that he died through the most woeful failings of basic health care. I mean, Connor was left to drown in a bath in a hospital unit, and he had diagnosed epilepsy. And we have to remember that people with learning disabilities aren't ill. There's no reason why people should be dying so early. You have got a tsunami of evidence that shows we know why people are dying, we know how people are dying, and we are doing nothing about it.
Last week, a coroner in Bradford concluded that neglect had contributed towards Myles's death. He dismissed the claim from the trust that he had capacity and said clinicians had a complacent and dismissive attitude towards his learning disability.
It's very raw listening to the whole list of times that Myles could have been saved. We feel, though, we now want to do something positive in the legacy of Myles so that people and families don't have to go through what we've gone through.
In a statement, the NHS Trust told us they accept the coroner's findings in full and offer their sincere condolences to the family. Myles did not demand much from society, just an extra bit of help, a moment's more care and attention. Instead, he was dismissed, his disability disregarded, and he died when he should have lived.